Good afternoon, Victoria. I would like to start this off. I have a couple of press releases that I'd like to read. They're prepared statements, and then we'll talk about some stuff, and then we'll have questions afterwards, okay? All right, the Victoria County Public Health Department is reporting a COVID-19 related death in Victoria County. The patient, a male Victoria County resident in his 70s, had been hospitalized in Victoria to respect and honor the family, and as per our policies, no further information will be released. It is unfortunate that our county has lost one of its residents because of the spread of this virus, and it goes without saying that the Victoria County Public Health Department, as well as everyone that works down here in emergency operations, extends its deepest condolences to the family and friends of this patient. Just prior to this, I was handed another release that I'd like to go over, and this will be released as well. The Victoria Fire Department is announcing that one of their first responders tested positive for the COVID-19 virus. This case is under investigation by the Victoria County Public Health Department as we speak. We became aware of this positive test this morning, and this individual has been isolated and is being monitored by the Health Department. The Victoria County Public Health Department is also monitoring the first responders' contacts and setting up needed tests, as well as working to identify any contacts of anyone that may have been exposed to this patient. Anyone found to have close contact with this patient will be contacted directly by the Victoria County Public Health Department. The fire department routinely screens its employees twice daily before they can report to work. And it's my understanding that this patient had no obvious symptoms of COVID while on duty. Out of an abundance of caution, the city is also evaluating any employees that came in direct contact with this confirmed employee. And it goes without saying as well that we will keep you updated on this and let you know everything that we know. As of today, we'll report our cases. As of 2:30 today, the Victoria case count of new cases, we have 8 new cases today. We have a total now of 104 cases. 36 of those cases are considered active, and 66 of them are what we consider recovered. Unfortunately, now we are at 2 deaths in Victoria County. The new cases, as I told you, had gone up to 8, and that actually is a pretty good spike for our area. We do correspond with the United States. I'm told that the United States reported 37,000 new cases of COVID nationwide, and that's actually one of the highest, if not the highest spike in a single day. We look at these numbers, and while these numbers, we certainly did not want them to go up, we're not surprised. I remember 7 or 8 or 10 days ago, we were talking about Easter, and we were talking about people social distancing and the importance of that. We actually have said from the very beginning that we expected numbers to go up, and unfortunately we were correct. Nationwide, they have gone up as well as locally. If you look at this, if you think 5 to 7 days, if you think about this virus and the way it spreads and the way that people get tested, it's 5 to 7 days typically by the time that they get sick enough to actually seek help. It takes another 2 to 3 days to get the testing back, and then you're at 10 days, which is where we are today, at 10 days from the last holiday. So there's a few things that we need to talk about, and I'll just go over these, and then we'll answer questions. And of course, you can see that the mayor and the county judge are here, and they're going to talk about new orders that have been released. You know, folks, we're in a new state of what we're trying to figure out as a new temporary normal. You know, when we look at this, unfortunately, it doesn't look like this virus is going to go away anytime soon. I've seen a lot of stuff in the nationwide media. I saw a thing today that one infectious disease expert said that if this was a 9-inning baseball game, we'd be in the 2nd inning. I've also seen other people reporting. In fact, the CDC came out today and said that they are expecting a second wave of this when the weather becomes cooler. And that's unfortunate because that will be about flu season. And we know that we have seasonal flu, and they're expecting a rather, unfortunately, robust flu season as well. So that's going to put even more of a strain on our hospitals, which brings me to my next point, which would actually be the point that I make every time I get up here, and that is that we have to practice social distancing. Now, we're going to talk about that. It may seem a little strange that We're up here talking about social distancing on the same day that we're going to announce that we're going to relax some of the standards or the restrictions here in Victoria. But I'm here to tell you that this has been carefully thought out and this has been carefully worked on. It's based on good data and it's based on a consensus of everyone here. So what we're saying is that we can lessen these restrictions if we do it correctly and we do it carefully. And that's what we're all about. We're going to ask more people to wear masks. I tell you that I ask people every time I'm here to wear masks. You greatly diminish your risk of spreading or contracting this illness if you just wear a facial covering. It's easy to do. I wore one the other day in the emergency room for over 12 hours almost straight. I had to drink water a couple of times, so I had to slip it off. But I'm telling you, you can do it. And I'm telling you that it's very important and it's very careful. We'll talk about those orders, or actually the judge and the mayor will talk about those orders in a little bit. This comes down to washing your hands, wearing those protective facial coverings, and probably most importantly, personal responsibility. If you get sick and you feel sick, you got to stay home. If you've been around a person that has COVID, you got to stay home. Isolation is still the best way to do this. Personal responsibility is what we need to talk about and what we need to adhere to. There's really no amount, or there's no practical amount of lockdown that's going to kill this virus. Now, if we could find a way to isolate every person in the world for 14 days, it would probably help. But that's not practical, it's not realistic, and the consequences of that would be worse than the virus itself. So what we have to do is do the best that we can, and that means isolate yourself and wash your hands, and please wear a mask. I say that, please wear a mask. So I will tell you that as the local health authority, I look at these numbers every day. I look at trends. I look at previous trends. I read something every day from people that know more about this disease than I do. And I want you to know that the mayor and the judge and myself have all worked very closely along with everybody down here in this Emergency Operations Center to come up with plans, working day and night, to figure out the safest and best thing to do. They're going to explain these things to you, and then we'll have questions. And if anybody has any questions, one last thing about testing too. I wanted to tell you that we have a list of testing sites that's going to go out on social media today. They're for Goliad, DeWitt, Calhoun, and Victoria County. So that will be available on Facebook and our social media pages so that you can see that. With that being said, I'll turn it over to Judge Zeller to discuss the new orders that I've alluded to.
Thank you, Dr. McNeill. Good afternoon, everyone. For those watching at home, thank you for your interest and for tuning in today. As Dr. McNeill has mentioned, we are implementing a new Stay Safe, Reopen Responsibly local order, which will better address the needs and the situation in our community. These new orders take additional steps to protect both the health as well as the jobs and livelihoods of our residents. These new orders acknowledge that we are not out of the woods yet. Certainly, the news Dr. McNeill just shared shows that we're not out of the woods. The virus is still with us. It's still contagious. And vulnerable populations remain at an increased risk. And we have to remain vigilant. It also acknowledges, though, the fact that a business which practices social distancing and common sense poses no greater threat to the public than any business in town with 1,000 people walking through its doors every day. Businesses that can comply with social distancing guidelines and face covering requirements should not be forced to shut down just because they are in the wrong category on someone's list of essential businesses. Everyone deserves an equal shot at staying open and staying employed. The changes in this new order that accomplish these goals are simple. We have declared all businesses to be essential businesses, removing the essential, non-essential distinction, except for a few specific categories that the governor explicitly closed and removed our ability to change. And we're also requiring that employees who have customer contact, we're requiring them to wear masks or facial coverings, in addition to practicing social distancing. This order still requires that sick people stay home, that people awaiting the results of a COVID test stay home, certainly that people who have tested positive for COVID and their household members, that they stay home. This order will go into effect tomorrow at midnight and stay in effect until April 30th, as it's currently written. This order takes steps beyond the governor's executive order in terms of protecting public health. It requires social distancing rather than just suggesting it, like in the governor's order, and now it will require face masks for employees in certain circumstances. And it goes further in the effort to keep our businesses open by declaring all businesses to be essential and deserving of the equal shot at staying open. We do know that the governor is expected to issue more details next week, on Monday in particular. I believe that's scheduled. We don't know what those details will be, whether it's a new order that goes into place immediately or further guidance on a particular topic. Depending on what that entails, it may require us to adjust our local orders. But with us having the ability currently to make these changes, we felt that it was appropriate that we do so. Again, this order does not reopen the specific businesses closed in the governor's executive order. Bars, restaurants, in-person dining, gyms, barbershops, those things will remain closed until the governor says otherwise. So those aren't addressed in this order. Before I turn things over to the mayor, I want to make very clear that us taking every legal step we can to protect the jobs in this community does not represent an all-clear signal with regard to the COVID threat. COVID-19 is still with us, and it's still contagious. It's still here. But at the same time, I believe that protecting public health and protecting people's rights and jobs and livelihoods don't need to be conflicting efforts. I think this new order is representative of that fact, and I think it maintains the appropriate balance that we've had in place over the past month. So with that, I'll turn things over to Mayor McCoy.
Thank you, Judge. We have accumulated and tracked case and testing data since we first issued our disaster orders. This data is reviewed by not only me and the judge, but by our Public Health Authority, Dr. McNeill, our Public Health Director, David Gonzalez, as well as our epidemiologist, Brittany Burgess. Our consensus opinion is that our testing rate is over twice the state average, and our hospitals and healthcare infrastructure has been and remains to be more than adequate to handle all treatment of COVID-19 patients to date, and has adequate capacity remaining, and face covering requirements will do more good in our community than closing non-essential businesses did. Therefore, given all this information at my disposal, the advice of our public health experts, and input from our emergency management policy team, which meets every day, I have concluded it to be reasonable to open up business in our community while strengthening guidelines for public safety contained in our new amended city and county orders. And to further add to that, and again, I will repeat what the doctor said and what I've said here every day. Whether we issue these orders or not, some of them mandatory, some of them suggested, it still takes the responsibility of our citizens to make this work. You need to play your part in being a responsible citizen, wearing your face coverings when you're out, avoiding things that you think are unsafe, and staying home when you can. So, and those are our only tools. The only tool we have, and we say it every single day, I know Dr. McNeill does it, is social distancing, now wearing facial covers, and wash your hands. And that's pretty much it. Now I'd like to say a little something about the essential, non-essential. The CISA guidelines, for which all of this was predicated on, were developed for natural disasters. They were not really developed in the context of a pandemic. So the idea that we struggle with, you have some businesses like a furniture store that sells appliances, or electronics is okay, but a furniture store that doesn't. So there's really no essential difference in a jewelry store, for instance. So we tried to clear that up because the danger is no more, and in many cases possibly less, for some of these people to operate. But we strengthen our deal because we're making the wearing of facial coverings and masks mandatory for businesses, the employees that have public interaction, and we're strongly suggesting and urging that everybody wear a facial covering when you're out and about. And that is where we get back into the concept is you need to be a responsible citizen and do your part in keeping Victoria safe. Now we'll open it up to questions.
Ingrid, go ahead.
Okay, so do we want to just go maybe one at a time, or do you want me to ask them all at once? How do you guys
Do you
want to
have
do
a
that?
lot of them?
I have a couple.
Okay, I guess we'll take, doesn't matter to me. Go ahead.
Go ahead.
My first question is, you have shown us a list of testing sites. Again, those testing sites, those are only to be seen by a doctor's previous approval, or are these at will for our citizens?
Well, the first line up here says pre-screening and physician order required. So yes,
Okay.
that would answer that.
My other question is really directed towards you guys about if you walk into a business and this was something that an immediate need that you had, and you walked in and nobody in that business was wearing a face mask. What is your advice?
I would walk out.
Okay,
I was going to say that.
Well,
that would be
agree.
your
Yes, I agree.
advice.
Yeah.
And what about I'm sure that this would be a tedious task, but a running list of businesses that, made the list and businesses that didn't?
That would be a tedious task and probably a one we wouldn't want to do with it being as expanded now as it is, except for those few specific businesses closed in the governor's executive order. All the others are able to be open as long as they adhere to the social distancing guidelines and have their employees wear the mask in situations where they have customer contact. So really, it's all the businesses that are currently open, plus those few, the unfortunate ones who were deemed non-essential under the CISA guidelines. Those are the ones that can now open if they practice the social distancing guidelines. I think it's clear that the majority of businesses did fall somewhere in one of those essential categories. What I like a lot about this order is that those unfortunate ones who are in the non-essential category, who maybe had just 2 or 3 employees, the mom and pop shop, that may very well, well, hairdressing is specifically closed in the governor's executive order. So unfortunately, we don't have the ability to address that. But there are multiple types of businesses like the jewelry store, the antique store, the golf course where they could not have an employee present, things like that that really only have a handful of employees where it's easy to social distance. They shouldn't be forced to be closed. Their reopening poses no greater threat to the public than Walmart or Lowe's or Home Depot with 1,000 people there. So I saw that throughout this process as increasingly unjustified. Early on, maybe, But as we've seen this progress, we've learned more about it. It's clear that those businesses ought not be closed. It accomplished no public health benefit, and their now being able to reopen doesn't pose a net public health risk. This new order, while we relax the one part of it by allowing non-essential businesses to reopen, we also take the step of now requiring the face mask for certain employees. The net impact of those two changes is a step forward in terms of public health based on our conversations we've had. So the net effect of this is a more focused and I think a more effective effort at public health, while at the same time letting those businesses that can social distance have a shot at staying open. I'm pleased with the direction this has gone in this order. I think it makes sense, it's appropriate, and it matches our needs here.
What about for businesses that have questions, where they just don't quite know where they are on the
Sure.
line?
We will be taking steps. The question was, what about folks in the community, businesses that have questions about this new order? Like with the previous order, we will be manning our hotline, having that available to the public. We will also be putting out helpful information on our Facebook page, the County Health Department Facebook page, and also having information on our website. So the same channels of communication that were in place last time will be here again.
Okay, so I have one other final question, which is, what about business owners and people coming in to visit them without a face mask?
The order that we have in place, the requirement does not apply to the general public. It applies as a mandate to the employees who interact with customers. However, it's still best advice for everybody out and about to wear those, certainly for people who are in high risk categories to wear those.
So business owners are mandated to wear a mask?
Employees.
Please, yes, to deal with the public.
Employees in any business that has customer contact,
Thank
yes.
you for clarifying.
Yes, absolutely.
Just, can I say a few?
Okay,
How will
yes.
that requirement for businesses be enforced?
I think you could, the question is on enforcement, how will that be enforced? I think you could expect it to be similar to last time where, well, last time being the current order, where the goal of law enforcement is as a resource and to provide information to the many businesses with questions. So I think you could anticipate the same effort at communicating to the public, answering these questions, being a resource. But certainly, the law enforcement has the discretion to take enforcement action based on that. Fortunately, as they've explained to us, that really hasn't been a problem thus far. Yes, ma'am.
My question was similar to that, but since you already kind of answered that, I have another question. Since we are requiring employees that have face-to-face contact with customers to wear masks, is there going to be any kind of requirement maybe issued in the future for the general public if you're going out and about to wear a mask?
The question is, it's now required in certain circumstances for employees. Do we anticipate it being required for the general public? I don't anticipate that being part of any future order.
Well, that being said, you know what my thoughts are, and I can tell you that in all honesty, I want to add to what our judge has just told us. From a medical standpoint, my concern, of course, is public health, and I understand that. But I mean, you have to understand that opening our economy back up is part of public health. So I think that we really have worked hard and found a way that we can probably do very well in both aspects. So getting back to your question, as far as mandatory masks, some areas have done it, some communities have done it. That's their decision. That's what they did. I think it would be hard to enforce. But I can tell you this, and I've said it already today, please wear a mask. It's very important. The numbers are very clear as far as transmission of this disease. When two people, even if one person has the disease and doesn't know it, if both people are wearing a mask, their interaction, especially at 6 foot, is very low to minimal to almost non-existent. That's how you stop this disease. We don't have a vaccine. We don't have a cure. We're not even sure if the medications we're giving are helping. But we do know that if we can stop that exposure, and that can be accomplished with facial coverings, then we will do better.
And to to address your concern a little bit, one of the things about this whole situation, it's been an evolutionary process. When this first started, we were given guidelines from CDC and other people who have radically changed during this process. So the way we've responded to this has been through an evolutionary process. The more we understand about the disease, the more that we can tweak our orders and our concerns and our responses to it. And it will remain an evolutionary process as we move forward. But it's like we all know, we have to learn to live with this situation. We can't just totally go and sit huddled in a corner in abject fear of what we're facing. So when we say evolutionary, we're going to use the same process as we continue to deal with this situation on into the future. So all the things that we've done to date are based upon the data and the facts that we know to be true, and using our best judgment. And when I say judgment, it's a consensus opinion of a group of people that brings us to this point that we're at today. So moving forward, if things radically change or the data changes, we will do the same evolutionary process and react to it appropriately.
I have one last.
I think Morgan was next.
No, I'm
Sorry.
Thank you. Dr. McNeill, you started this and you said that it might seem strange to announce these kind of looser restrictions, at least for businesses, in the same meeting that you're announcing a new death in 8 cases. Can you guys all elaborate kind of then on the choice to do this today?
Well, we thought it was important to get done, and we can't predict when there's going to be spikes, and we certainly can't predict when there were deaths. And in all honesty, I'm probably giving up a secret here, but we had talked about, well, should we wait and not release it on the same day? And those are the kind of conversations we have every morning. And this morning we had that conversation, and we decided that everybody needs to know, and we need to move forward, and we need to do what we think is best for the community. It's unfortunate that and maybe a little ironic that we're announcing on the same day, but the most important thing to remember is that we think and we believe, based on facts and data, that what we're doing is safe, and that what we're doing, and from a public health standpoint, I can tell you that I feel better having people wear masks and social distance, that the business about opening up a small business that has a few people in it, that's not my big concern. My big concern is everybody being around each other, regardless of if they're 6 feet away. You know as well as I do, if you go to one of the bigger stores, you're not going to be 6 feet away from everybody at every minute. And it only takes a little bit. A person coughs, it's in the air, you breathe it in. That doesn't happen if both people are wearing masks. And that's the good part of it from the public health standpoint.
To comment on that further, Morgan, some realities we would need to look at. I mean, to answer that question, I think it's fitting and appropriate to implement this and to implement this now. A reality we need to remember is that as testing increases and increases significantly, we know it's a goal of the governor to increase that testing statewide. We're seeing the mobile unit in Calhoun County. We may well see others of those in our region. As testing goes up, the number of confirmed cases are going to go up. We will see more confirmed cases. A large part of that is a function of doing the increased testing. So simply because new confirmed tests come in, I don't think that makes this the wrong move. We've anticipated seeing that, and we'll continue seeing that. When you take aside the semantics of loosening things up, reopening the economy, put that aside, and look at the specifics of exactly what we're doing on the ground, what that looks like, you'll see that there's really no significant increase in exposure. These non-essential businesses, as they were previously deemed, opening up, that's really not where the threat is. That's not where the vulnerability is. So where at the same time, we're going to be requiring masks in certain instances, strongly encouraging it in all others, the net effect is a step forward for public health. So in spite of the numbers today that coincided with the announcement of this, I see it as still being fitting and appropriate. Let's see, was there a question back here?
Oh, yes. I was just wondering, since we talked about how it was going to be enforced that employees wear these masks, is it going to be enforced like there's going to be a number you can call if there's a business in violation, or?
The same process and apparatus that has been in place will remain in place. We'll have our hotline for general information. Law enforcement will continue to serve as a resource for business owners. Certainly they have the ability to write a citation if need be, but what we have experienced is that people in general, businesses in particular, want to comply. In fact, many already have directed the employees to wear facial coverings. I think Walmart, in fact, is one of those. But as far as that goes, I think it will be similar to what you've seen previously. However, to really get specific there, I'd have to defer to our law enforcement folks. That's their prerogative on enforcement, and they could answer that more specifically. But I think you could anticipate it being similar to previously. Yes, ma'am.
Dr. McNeill and gentlemen, one of the things that I had heard you say the other day I thought was very candid and something that we needed to really start to consider, which is that it's not going to go away. Do you see that in 3 or 4 years we're still going to be dealing with COVID-19?
I actually saw data today that this virus, the latest studies on this virus show that it's probably going to be an annual type virus like the flu. Now, that being said, that comes from the guy that told you about a month ago not to wear masks. So I'm just telling you that's how the data changes. So it's hard to know.
Then can I ask a second part, which is antibodies, immunizations, anything like that coming down the pipeline that you feel confident might better protect us for the next go-around?
I think it's a piece of the puzzle. And I think that there's a lot to be learned about the IgG and IgM testing that you're talking about. Those tests look at specifics as far as previous exposure to the virus, and some of them will tell you if they're acute, some of them will tell you if they're chronic, but it's not a replacement for an actual test that tells you if you have the disease. It's a difficult science, and I'm told that there are over 60 different manufacturers now that are making those tests, and I don't know if any of them are FDA approved. There may be a few that are FDA approved. So it's a lot of new science out there, and it's a lot of stuff, and the bottom line is that we don't know enough about this virus to know what the norm is going to be. We don't know what kind of immunity you're going to get, if any, and even if you do get it, we don't know how long it's going to last. The last coronaviruses that we know about, the two that the most common associated with common cold, have about a 45-week time frame that you will have immunity. So what does that mean? Less than a year, just like the flu. Think about it. You get a flu shot every year. If your immunity lasted longer than a year, the flu shots would last longer than a year. So that's what I'm talking about, this whole immunity thing. We would like to think that everybody that has had COVID will never have it again, but no one can tell you that that's factual. So we have to wait and see, and unfortunately, it's going to take time, testing, and more time to figure that out.
Take a couple more. Morgan, go ahead.
Judge, you mentioned that the governor's state orders somewhat dictate where the city and county can set restrictions.
Yeah.
Can you go into a little more specific as far as, are there certain areas directs that those, and I know you even said next Monday might change things.
Absolutely. So the question is about the governor's orders. They clearly supersede local orders, but how is that impacting us? What can we do? What's the extent of options available to us? The governor's order ushered in statewide the concept of essential, non-essential businesses. That's where that came from. That's where what our previous order was based on. However, there was apparently some flexibility there, some vagueness, even some questions we directed to TDM, to the governor's office. We were told basically there wasn't an answer for that specific, no guidance for that specific situation. So there's that element, but also in the order, there were, the governor's executive order, there were a few specific listed businesses for which there was no ambiguity. In-person dining in restaurants, massage establishments, cosmetology shops, barber shops, those were all ordered to be closed, which was very clear. It was a shall, not a should. There's a lot of shoulds in the governor's executive order, which we interpret as being optional, recommended, not mandatory. But there was a shall as it pertains to that list of businesses. And then at the end of his executive order, he removed the ability of local officials to do anything inconsistent with his order. My question was, kind of like you're asking, when does a difference become an inconsistency? What's our realm of, what options do we have? Well, based upon our legal advice, the attorneys we have and everybody we've spoken to, we believe that we can loosen the restrictions as it pertains to essential, non-essential, but that changing the requirement on those specific businesses, barbershops, for example, goes too far. So we can take the step of making everything essential except for those that are specifically closed. So the step we're taking based upon our solid belief is that that's legitimate, accurate. Now, it's certainly possible that the governor could come in and issue something new where that step is specifically prohibited. In theory, that could happen, in which case we would adjust our orders to comply. But clearly, what we're doing, we feel it's legal and appropriate, otherwise we wouldn't be doing it. But clearly, it's also our position that those bars and restaurants and barbershops, we don't have the ability to address those. Same as with surgeries, elective surgeries. That's something governed by the governor's executive order, and we really don't have any leeway over that locally.
Which he has loosened his requirements on
Right.
that.
Yes, probably will continue to do so.
And there are processes within the governor's order. I know from our state representative that certain associations of certain businesses are putting together models in which they think they can operate safely, and the protocol is to submit those to the governor's audit group, his panel. They will review those and then make decisions if those businesses, some of which are on this list, might in the future be allowed to open. But everything in it is about opening safely and responsibly. I don't see any sort of cavalier nature to anything, just opening up everything without any consideration for the safety and the prudence of doing so. So, like I said, it's a process. Everybody's struggling to do this as safely as possible. But as we've also said, there's two components to public health, and it's being demonstrated all over the nation. You can see the different things, but it's like I said the other day too, we're very fortunate to have a public health department that we have, and a public health authority and an epidemiologist, which many communities don't have. So we have a lot more truly solid advice than many communities have. I was on conference calls with other mayors and stuff, and some of these communities don't have the resources that we have. So I think it's important for people to understand the judge and I, we sign the orders, but we don't independently make these decisions. We go through a rigorous process of discussion and debate about what we should do. So I think people should take solace in the fact that we don't take this lightly. We don't take it lightly at all. I mean, and I'll tell you, I didn't go to bed last night till about 2 a.m. You know, this stuff is on your mind all the time. And so I don't take this cavalierly at all. It's serious business. but there are serious decisions that have to be made, and unfortunately, the judge and I are the ones that ultimately have to sign those orders. And I feel confident in it. I feel like I've gone through a rigorous process in my own mind, coming to the conclusions I have, and I'm at peace with it. Okay.
All right, we've gone a little long, so we will go ahead and wrap up. Again, thank everybody for tuning in. A copy of this order should already be posted on the Health Department Facebook page as well as our website, victoriatxoem.org. We will continue running the hotline, 580-5796, as always, to answer questions from the public. Anybody with unmet needs, 211 is still an available resource. 24/7 mental health support is at 833-986-1919. We will have the next press briefing at 3 o'clock on Friday. Thank you all.
Thanks.